specifically the Youth Business Lounge. My name is Falda Chirabo Nachimali, and we are continuing with the topic of the day, which is drug abuse on mental health. With me, I have a very proclaimed and specialist in the field of drugs and drug abuse, known as Dr. David Kalema, the Executive Director of Hope and Beyond Rehabilitation Center. And I'm very pleased to have him on the show today. You're welcome, sir.
Yes, I'm happy to be here, and I want to send my greetings to our viewers over there. It's really a pleasure and honor to join you. Thank you for the invitation.
Thank you very much for honoring the invitation. Well, we would love to kick off this session with some questions that need to be specified and understood by our viewers and the people out there. And my first question would be, what is the difference between drug use and drug abuse specifically?
Okay, thank you very much. Maybe before I can answer that question, can you allow me to talk a little bit more about myself?
It is very fine, sir.
Okay, David, thank you. David Kalema, work with Hope and Beyond, which is a rehabilitation center for people with alcohol and drug abuse problems. I'm actually a doctoral holder. I have a PhD in psychology, majoring in treatment methods for people with substance use, especially alcohol. Yeah, so I am really happy and excited. I've done this kind of work for about 20 years. I've seen so many people going through difficulties but making it. So you wanted me to talk about the difference between use and abuse.
Yes, please.
And that's a fundamental question. Use, we use the term use, drug use, whenever the person is using. And I'm using the word use to define use.
Okay.
When someone comes into contact with the drugs for purposes of satisfying any intention. So any interaction with the drugs, it's used because it can be ingested by mouth, it can be smoked. Some drugs, even these days, produced in form of chewables, come like chewy gums, like chocolates, like some in candies. Some can even be smeared, or injected. So all that is used. But more technically, we look at the term use when you are going to take this medicine, the drug, because even medicine is a drug, it's a psychoactive substance. If you are going to take it in a prescribed manner, you've gone to a doctor and the doctor has said, please take this medication 2 times 3, there you are using. Now, if you take this medicine, any type of medicine that is not prescribed, and maybe, I'm feeling headache, let me take some Panadol, no one has prescribed.
Yes.
I have this, these days I'm not sleeping, let me look for sleeping tabs, not prescribed. That's abuse.
Okay, that's abuse.
Yes, but outside the medical management, we also have like excessive use of alcohol. That's abuse. We have these other drugs that are not even prescribed, like marijuana, like, all those narcotics. Actually, narcotics are not used. Narcotics are abused. Marijuana, cigarette, cat, any narcotic, that is any illegal drug, that is abuse. Yeah, but with medical drugs, you can have the word use. Now, for us, as helpers, we have found more comfort in using the term drug use than drug abuse. Because when you say drug use, you appeal to many people. And when you say drug abuse, it's a put off for some people. They may feel judged because of that negative connotation.
That's true.
So I think for this program, we'll keep talking about use, even when we mean that is,
Abuse.
yeah, sometimes the use is not actually used. They have crossed the line into
Okay.
abuse.
When you say that narcotics are used, I would buy, but not prescribed. A question comes into my mind, and that question is there a possibility that narcotics could also be prescribed to someone for health matters other than recreation or just using them as drugs?
Yes. We have the drugs classified as opioid narcotics.
Okay.
These usually play the role of killing pain. And I these days don't even want to mention the brands, because sometimes when a young person is listening, they might try them out, which serves against it.
Yes.
But many of the pain-killing drugs, especially those that really are severe in killing pain, they have an addictive component. And many drug users who eventually become addicted go for them. Yeah. So I think people have to be very careful when they are using painkillers. Some of these drugs, though, are prescribed in some conditions, unavoidable conditions. For example, in terminal cases, you heard of hospice. There are patients, for example, patients with cancer who are under a lot of pain, and usually, most of the times, they will tell you maybe you have 6 months to live or this time. So in the wisdom of the doctors, they want to give this person relief, so that they can keep living, at least not in pain. They know that by the time the long-term negative effects of these drugs have set in, probably this person may not be alive. So these drugs can be used in some exceptional situations, like these ones that I've said. And sometimes like some people, when they really don't have appetite and they are suffering from terminal illnesses, maybe they are in late stages of AIDS, some of them can be administered such drugs. Yeah, those are the narcotics or opioids. Otherwise, ideally, there shouldn't be a no-go zone for someone who is functioning normally.
Okay, thank you so much for sharing that. That has really been very insightful. And my next question would be a bit personal, and it would be, why did you choose a career in drugs and drug use, specifically to the level that you have acquired a PhD in it? That is quite inspiring.
Yeah, thank you.
You're
It's a big question for me also. It stems right from my background. As a growing person, I encountered challenges with my parents. Yeah, one of my parents, he was using alcohol and in too much quantity. So we really suffered with her. May her soul rest in peace, because she eventually died. Yeah, and actually she died of liver cirrhosis. Yeah, but that was some time back. She died about 30 years back. By then, this drug and alcohol treatment campaign or programs were almost not heard of. So the doctors were busy treating a sick liver, but this lady would get out of the hospital and drink and go back to the hospital and receive her injections. and when she's discharged, she would come and unleash terror to us as kids growing up.
Wow.
And yet, when she was not drunk, she was a very good woman. Yeah, so I said, okay, when I grow up, I think this is something that we need to, not so many people, I mean, not...
that we should find a solution
people shouldn't suffer. There are so many families
Yes.
that are suffering.
Yeah.
The way I'm suffering as a child. This shouldn't happen in families.
Definitely.
So then, when I left university, I started working with several organizations. And slowly but surely, my passion drove me to one workplace where I was really working directly in this area. But again, I lost that job. I lost that job after serving like 5 years, and I felt I had done everything a human being can do, even beyond, because this organization really grew a lot, incredibly. And here I was meeting with the situation of having to leave the organization, and I felt so bad, and I didn't have another job. The 6 months that followed were so depressive. I had a family, I had a young family, I didn't have a job, I didn't know how to provide for them, I went in depression. I really loved my family very much, and when I saw them suffering, I started thinking, oh, they are suffering because of me. And that even made me feel worse, and even contemplate suicide. I said, now why did I even have to start a family that I cannot sustain, looking at someone's child struggling, and it felt so bad. During that time, I really felt a sense of loss of hope. I felt hopeless. But I had a few friends who thought, oh, but you can do this. You don't have to look at the job that you've lost. Just look at your potential. So these friends helped me to ignite into myself something that I had for long overlooked. And I said, okay, I'm in despair. What can I do? What do I have to cling on? It's only hope. And they were like, yes, hope is all you have, but hope is everything you need.
Yes, indeed.
So he said, okay, then why don't we start an organization called Hope? But hope is not enough. And he said, oh, beyond the hope, there is life.
There is life.
So we started Hope and Beyond.
Hope and beyond. Wow.
And that was 14 years back.
Yes.
And since then, we have grown from baby steps to a big organization and employed so many people and transformed so many lives. So like from that really bad situation I was, I got a strong inspiration to turn tables around on life.
Okay, I kind of have come up with a number of questions from what you've just said.
Yeah.
And one that is actually has nothing to do with drugs is something that you've talked about your foundation and how you ended up in this career path. So to a personal level, do you think that where we grow up or where we come from, it has to do with the choices that we make in future? For example, drug use, or on the positive side, what we choose to become, to do with our lives, and maybe on the negative side, the addictions that we choose, the ways we start to cope with life. Is it something that is affiliated to our upbringing, just like you have mentioned?
To a very large extent.
To a very large extent.
Yes, to a very large extent.
Yes.
Our upbringing, if you remember when we were children and we are mimicking our parents, the first role play of a boy is in direct link with the father's occupation. Whether the father is riding a boda or the father is, an office holder, a white collar job, or what. So we always derive the first impression from our parents. But many times also our parents fail to be the role models that we are looking forward to. And that's the time when people maybe start looking elsewhere. Either they will cope dangerously. For example, if you have a parent who is abusing you, or who has neglected you, who is not there for you, sometimes you can cope dangerously, end up on the streets, end up in drugs, end up, in very funny things, promiscuity and all that. And yet, there are also those ones who can say, okay, how can I be a hero?
Definitely,
Eh?
just like you.
I'm honored that you're thinking about me like
Very
that.
much so. I am.
So, yeah, so there are those ones who can say, but we can do something about it. Yeah, and unfortunately, these may not be so many, which is always a word to the parents and to us future parents, maybe who are watching this, to be very careful that kind of example you give to your children, because it will shape their life, even when you are no longer there.
Okay. And with your continuous interactions with the people who are in recovery at Hope and Beyond, the rehabilitation center, or probably where you have gone to lecture, what are some of those reasons as to why you think people are using drugs? And not just any reasons like peer pressure, but those, those deeply rooted reasons that may be ignored by a number of specialists out there who don't know the root cause as to why people are using drugs.
I really like that question, and the reason I have laughed is because there's this fallacy. People think that it always has to be big reasons.
Okay.
You understand?
Yeah, I do.
And many times we ignore
the small ones.
those ones we consider small are the most important.
Yeah.
So, for example, you've just said a very big reason and undermined it completely.
Okay.
But it's actually the leading cause of drug use.
Even
Even when I was growing up, even in the history, as I said it, there's still some people who would come and say, David, try this.
Okay.
If I had listened to them, that would have been. So usually, for a young person who is growing and impressionable, because the age of teenagers, it's also the age of exploring. And these other teenagers keep telling them, oh, Kanukakuba, this one is nice. This
Try
one,
this, it's better
yes,
than that one.
you will vibe, you will what, and yeah. So usually the peers introduce. The other one we've talked about it to the family. When these substances are in the family, then the environment,
Okay.
then the advanced things, like when they think they want to perform better, they take some drugs. For example, Cuba. Oh, sometimes I don't want to say these things, but I know there are some young persons who take such drugs when they think they are going to help them to enhance them.
To recreate.
And yet they are just going to destroy them. They want to sing longer or better. They want to excel in sports.
They want to party.
They want to party, so
Yes.
they take those drugs
Yes.
and they just destroy themselves.
Okay. The reason why I talked about peer pressure in that manner is, for example, at university, you go for a party and they tell you to try out this drink, or maybe try out this now wine, try out these shots of some alcohol. And at first, it is like a group thing. You do it as a group, the
Yes.
two of us. That's how it becomes a pattern. Then the next weekend we meet, we do it together. But at the end of the day, you see one person completely seclude themselves from the group and start to do it alone.
Yes.
From being a weekend thing,
Yeah.
it starts being a daily thing. Every other time they need it to function. So what would it be that causes this person to remove themselves from the group and start doing it alone behind closed doors, to the extent that they can't come out and seek for help from other people?
Okay. Now, the issue is when someone starts using drugs, they set themselves on a path, a growth path, which escalates into addiction. In between there are stages. Starting to use is experimental. I should say, oh, how does it taste? How does it feel? Eh? If you are not lucky to stop there, yeah, you go into occasional. When there's a party, let's party every weekend. Eh? You dance off, you whatever, occasional. Eh? And after occasional because occasion is also recreational. And after that, then you start having it like in a functional way. You need it to function.
Function on a daily.
Yeah, or you need it to maybe to sleep, or to get courage. You're going for an interview, or every evening, kind of becomes more of daily. So that's habitual, becomes a habit. There are people there who cannot sleep without taking alcohol. There are people there who cannot even perform anything with that. So, and after that, it becomes the real addiction now, full-blown addiction, where someone completely loses control over the drug. The drug. When the drug means everything in this person's life, nothing matters more, not their parents anymore, not their jobs anymore, not their studies anymore.
Wow.
Now it's drugs. And anything that comes between them and drugs is their enemy.
Wow.
To the extent that they start secluding themselves.
Okay.
However, they are even, depending on someone's social inclination, because we usually have loners and the
Outgoing people, the extroverts.
The extroverts, yeah.
Yes.
So sometimes someone can still be an addictive user even when they are in a group. So it's not that every person who is really addicted has to like isolate themselves.
Yes.
A few do that, but others still remain drinking in a group, but when they're actually living in an addictive lifestyle.
Okay. So I would love to know, how can I help my friend out there? Perhaps tell them in a more comforting way to seek for help. Because in most cases, when I see some people out there, when you decide to tell them, they get so angry. They feel like you are attacking them.
Yes.
Yes, at the end of the day, I'm not attacking you. I'm attacking the habits that you're having. So how can I politely tell them to seek for help, to make better choices when it comes to drug use?
First and foremost, love. You have to love these people. And you have to love them in a tough way.
Wow, I felt that. Love, okay.
Love is very important. When you're talking to someone out of love, it shows. It shows because you really show them that you love them. Even if you're going to take a tough decision, you tell them, we are taking this tough decision because we love you.
Yes.
We don't want to miss you. We don't want to lose you. You are so valuable. You are so important. So we have to go to a rehab, even against your will.